Dr. Himadri Choudhury.
Good afternoon. My paper is Genie in a Bottle, Reversible Nutritional Optic Neuropathy in Northeast India. I do not have any financial interest in this presentation. Among the various colors of Northeast, the Mar, Mizo and Naga are the ones that hail from in and around Assam. I hail from Kachar, so I get a lot of these patients. The background of this study is India has the highest market of smokeless tobacco, and incidentally, Mizoram has the highest prevalence of tobacco consumption. What is not known is liquid tobacco as an entity and its ophthalmic sequelae. The purpose of our study is to report reversible toxic optic neuropathy in 43 young and healthy patients belonging to the indigenous tribal communities of Northeast India. All of them presented with diminution of vision in both eyes. They gave history of intake of liquid tobacco. It is a retrospective case series where detailed medical and dietary history was taken. Clinical evaluation involved color vision, visual fields, and OCT studies. Demography profile, duration and frequency of liquid tobacco use was also taken. So what is this liquid tobacco? I have seen patients sipping this brown colored liquid from a bottle. I was quite intrigued by that. The local name is Tuibur or Hidakfu. It is a form of tobacco water mainly popular in the northeast states of India. It is a widespread social and cultural acceptance. It is as common as tea or coffee, and they have a misconception that water purifies the tobacco. So on investigating further, I visited a Mar village where I saw the production of this tuibur. Here the tobacco are dried and then they are set to fire in this earthen pots, and the earthen pots are connected to glass bottles. With the help of a hand pump, the smoke of the tobacco is percolated or infused into the water until the time the fluid is totally supersaturated with the smoke, and then a cloth filtration is done, and this is the end product. So what is the mechanism of toxicity? Stripping volarimetry of tuibur has shown that there is presence of heavy metals, myosmine, carbon monoxide, and cyanide. All these cause mitochondrial DNA damage. The respiration in the mitochondria is reduced ATP, increased oxidant stress, and all these causes demyelination. The patients were started on vitamin B complex with methylcobalamin. They were advised to discontinue tobacco use. Out of the 43 patients, 83% of the patients were female, 61% were Mar, another 30% belonged to the Naga, Kuki, and Mizo, mean age being 29 years, and duration of tuibur intake was mean 7 years. So these are some of the patient, normal looking fundus, normal OCT RNFL, but typically in the perimetry you can see central scotoma at presentation, and after 1 month of treatment you can see reduction of central scotoma. Another patient here presenting with temporal pallor, OCT showing temporal RNFL thinning, and you can see the perimetry, central scotoma, deep central scotoma, but after 3 months of treatment, remarkable improvement in the field, and also the vision is improved. Another case showing again central scotoma. So the logMAR vision at presentation and after 3 months was statistically significant. Vitamin B complex supplementation is successful in treating, and how so? Because of conversion of free cyanide to cyanocobalamin. So all 43 patients had a statistically significant improvement in vision and also the visual field indices after treatment. As you can see here in the parameters of perimetry, visual field index and the pattern standard deviation at presentation and after 3 months of treatment are statistically significant. So tuibur has been reported in literature, but it has been linked to stomach cancer, and there has been some local publications of tuibur, but to the best of our knowledge, this is the first ever study linking liquid tobacco to toxic nutritional optic neuropathy. We conclude that nutritional toxic optic neuropathy can be caused by a multitude of agents. However, the mainstay of treatment is replacing deficient nutrients, eliminating the offending toxin, and it is important to consider contributory social, cultural, and dietary practices. Thank you very much for your kind attention.
So it's a condition of a toxic amblyopia, just like
Just like you
kind
have a
of.
methyl alcohol, illicit alcohol, done usually in the illiterate forest. They drink illicit alcohol. It's toxic amblyopia.
But the difference here, sir, is
was it reversible?
yes, sir. That is the catch here. That in toxic amblyopia, usually the vision doesn't improve. But here, when we can detect it at a particular time, then and they are stopping that liquid tobacco intake, then the field is also
How are you
improving.
sure
And
that they will stop?
no, we are not sure. Of course, we are not sure. So the field is also improving.
It's a kind of addiction. So it's very
Definitely.
difficult.
Definitely.
But of course, and then what happens is that there will be withdrawal symptoms. It's very difficult. Basically, do a little bit of pediatric ophthalmology. You have got the children during the period of COVID, when they just do these mobile games and all that stuff.
Yes.
I see the children after COVID brought to the pediatrician because they get eye ache, headache, irritability, change in behavior, migraine, sleeping the phones, then later on they get also delayed milestones, autism,
Yes.
squint, diplopia. And the parents think that they have got a pediatric problem, and only an intelligent pediatrician who sends to the patient to a pediatric ophthalmologist that he detects that I got a twin during the period of COVID, 6 years. One was a gentle twin, he was not playing games. Other was a twin. He had a squint of about 25 degrees. And when I assessed -2 cylinder 20 degrees, he put it after 1 month, it disappeared. So it's very important that the parents should not give this mobiles and then they play it. Encourage the children to play outside games. Same thing is here. It's a question of addiction. So now we called it as a mobile laptop syndrome. The same thing is here. It's addiction. Well, if it's good, if it's reversible, it's good.
It's very interesting and very well
Very
presented.
interesting. Very interesting.
Thank you.
Yes, thank you.